The most common knee injury that we see in the office is a tear of the meniscus. People often ask, what's a meniscus? We describe the meniscus as the shock absorber of the knee. It's a cushion that sits between the femur bone and the tibia bone. So that is subject to pounding forces when you're running, pivoting, or twisting. If you happen to turn and pivot the wrong way, you can grab the edge of that meniscus and create a tear. Now, the meniscus has hardly any healing chance within it, and that's why once you have a tear, if it is in a sensitive spot of the knee, it's going to be quite painful and create quite a bit of inflammation. And that will create pain from that tear. Because you have to step directly on that tear, there are some activities that make pain and some that don't. And patients will often ask, why do I have pain some days and not others? It all has to depend upon when the pressure point hits the tear. It can be as sharp as a lightning bolt, or it can just be a dull ache inside. You don't need a trauma to tear a meniscus. Yes, we see them in sporting injuries, but actually most of the tears occur in the weekend warriors. Just outside gardening, I got up from the ground and I felt a twinge, and that's what began. Not every meniscus tear needs an operation, because if this tear is in the back corner of the knee, we can calm it down through either anti-inflammatories, ice, sometimes cortisone, and again, also physical therapy. Because the stronger your leg muscles are, that takes the pressure off of the tear. So some tears you can actually leave alone if they're not causing any symptoms. It is the symptomatic tears that don't respond to these non-surgical measures that end up needing surgery. Arthroscopic surgery of the knee involves putting a scope no bigger than a pencil into the knee. From that, we can examine the whole knee, top to bottom and all the way around. So I liken it to Jiffy Lube because we do a 30-point inspection when we go into the knee, checking the ligaments, the bones, the cartilage, and then finally getting to where the tear is. The tear itself can look like a splinter when you're in there. So literally what we do is we go in, we take the splinter out, and then we smooth down the cartilage to get back to a smooth rim. We try to leave as much cartilage as we can behind, and we only remove the damaged section. People often ask, why can't you sew the meniscus? You can't stitch the meniscus because the area that's torn is typically no thicker than a piece of tissue paper. And it's impossible to put stitches in, number one. And number two, there's no blood supply to that area of the meniscus where it's torn. That's why it has no healing capacity. So that's why the meniscus is typically removed. And everyone, unless the tear occurs all the way at the periphery where there is some blood supply, and that's a very limited number of procedures, probably 1% to 2% can actually be stitched together.